Antibiotics can come in handy when treating bacterial infections, yet it's important not to misuse them.
For this week's Health Watch, Dr. Kara Hamilton goes over the importance of using antibiotics responsibly.
Antibiotic stewardship is the medical term essentially for the responsible use of antibiotics. How do we use antibiotics responsibly? Basically, we're using them only for the infections that need it, only with the people that need it, and to take the antibiotic in the way that it was prescribed. The infections that need it, first and foremost, no viral infections need antibiotics. They do not work for viral infections. So most of our colds and some of our ear infections, some of our sinus infections and pneumonias are actually caused by viruses. Some mild bacterial infections also do not need antibiotics. Mild ear infections, mild sinus infections, and even some UTIs will clear on their own given proper anticipatory guidance and symptomatic treatment and care. Certainly there are some people who are more at risk for infection and may be prescribed antibiotics a little more often. And again, that's the rest of us, we try to use responsibly in order to protect those people a little more. It's not your job to know all of this, but rather your job to not be pushy when you're seeing the provider, and also just to be curious. If you feel like your provider jumped to prescribing antibiotics, you can ask questions like, does this infection really need antibiotics? And what would happen if I chose not to take the antibiotics? Or how quickly would I know, how quickly would I get sicker if I really needed these? And of course, if you are prescribed antibiotics and decide to take those antibiotics, make sure you're taking them properly. If you have questions about antibiotics and the proper use of, don't hesitate to contact your child's pediatrician. This is Dr. Kara Hamilton of Black Hills Pediatrics with your Health Watch.